Good afternoon. Welcome again. We're going to go straight into the sort of operational updates. So this afternoon it'll be Dr. Brink, the Head of Law Enforcement, the Chief Executive, Heidi, and then myself, and then we shall go straight into questions. We're also going to interpose some of the My Coronavirus questions that we had directly to us, so we will alternate between some of those. But I'm going to hand straight over to Dr. Brink for an update, please.
Thank you and good afternoon. So first of all, an update of our latest figures. We've now tested just under 1,500 cases or people on the island and have a total of 191 that are now positive. So that's our positivity rate. Encouragingly, 40 people have recovered completely, so we've got 40 completely recovered, and today we have 5 people in our hospital, none of whom are in intensive care. So that's a summary of where we are. Now, every time I come and talk to you, I try and think of a topic that I've been asked about or you've asked me about. And this week or today, it's about what my primary care colleagues have asked me. So one of the things that they're particularly concerned about is the identification of patients who are shielding. Now, shielding, of course, is our particularly vulnerable group of individuals. These are people that are very immunosuppressed for some reason, who are currently receiving chemotherapy, who have severe respiratory tract conditions. Some of them have inherited metabolic disorders. So they really are very vulnerable. And these people should be shielding, so should be out of contact for the duration of what's going on at the moment. So we think that's going to be about 3 months. Now, they're concerned. They've been trying to identify these people through their own practice records. What they asked me to say is if anyone who feels that they've fallen into a shielding criteria and haven't received a letter, please do contact your GP practice. Really important, because they're very anxious that they give the appropriate care and advice to you. So you can get information on who should be shielding on gov.gg/coronavirus in the over 65s and vulnerable section. So really important that we identify those people to make sure that we give the appropriate advice. Testing continues to proceed very well. We do 2 to 3 runs a day now. We take the last run off at about 10, 11 in the evening. So again, the pathology staff are literally working around the clock. We then produce the updated figures every morning. So we're trying to give the most updated data we can every single morning. I think that's important because we want to share the information we have. I've also been asked about the category that we've introduced on suspected or presumptive deaths. Now, from my point of view, this is all about trying to be open and transparent with you. And so we have the groups of individuals that are proven coronavirus deaths. Now, proven coronavirus deaths, we've tested them in the laboratory and we've detected the virus. That's absolutely clear. But there are other groups of individuals that have either tested negative or haven't been tested at all, who we think clinically they've got coronavirus, usually through contact with a case. And I think that's really important that we include those people in. So that might be, for example, the main cause of death might be bronchopneumonia, but then with a possible underlying cause of COVID-19. So that then just tries to make our data as complete as possible. Now, clearly, we might overcount cases under these circumstances, but we would rather get as complete a picture as we can as we go through these really unprecedented times in our healthcare service. And so we're always looking to how we can make our data as comprehensive as possible. And again, what I would ask you to all be aware of, this is different to what is being reported in the UK. So we're reporting confirmed and presumptive cases. And I think that's important when we consider the facts and figures that we've got within our bailiwick. So I think those are my main summaries for today.
Sure.
Thank you.
Just on that question of deaths, one of the things we've talked about is actually separating out those that die in hospital, which is what would be picked up and reported in the UK, versus those that are confirmed positive but die outside hospital, which of course have not been identified in the UK, so that it gives a better comparison. So that's something that will be reported going forward.
So we'll start reporting on that within the next 24 hours. So certainly by the end of the weekend, we would have separated those two groups out. And again, I think it's important. We want to report our data comprehensively, but we also want you to have it in a format that is comparable to other jurisdictions. So we want to present in a data that is clearly understandable to everyone. But I really want it comprehensive because I want to capture as much data as I can, because that's the only way we will stay on top of what is or keep abreast of what is happening.
And it really speaks to the quality of the data that we have compared to some others. But Rory, over to you.
Thank you. Good afternoon. Law enforcement continues to support public health in a number of areas. Staff at the borders are continuing to monitor individuals travelling in and out of the island, and any people coming into the bailiwick are still being required to self-isolate for 14 days and given the appropriate documentation. We're also keeping a close eye on any other traffic coming into the bailiwick, and that includes both vessels, boats coming into the harbour that may be private vessels, as well as any private aircraft. So just to reassure the public that any individuals travelling into the bailiwick are still being closely monitored and advised as to their self-isolation on entering. From a policing perspective, we continue to enforce the restrictions that are in place. But as I've said on previous briefings, it is about public engagement, it is about community policing, and it is about working in partnership with everybody. So I can confirm that that operation is ongoing. The weather is lovely today, and we anticipate the weather to be equally good for the next couple of days. Our staff will be out there, and we will be ensuring that people are complying with the rules and regulations around exercise. This is about protecting the public. This is about protecting each other and stopping the transference of the virus. And I would ask people, please, don't try and push the boundaries. You know that these rules have been explained, or you need to go to the government website to see where they're clearly referenced. But they're there for a reason, and they're there to keep the community safe, to keep you and your family safe, and everybody within the community safe. And all we would ask is comply, because the win in this situation would be, as we've always said, the reduction in that curve, that spike, that impact on our health service. From an enforcement perspective, we have had to use enforcement powers, and in fact there are 2 investigations ongoing. Because they are ongoing, I can't comment any further, but just to reassure the public that where we have to take action, we will, to protect our community. I mentioned last time I was here about the roads. We're still receiving some information that people are driving relatively quickly at times around the island. Please keep your speeds down, because the last thing we want is additional pressure on the health service from road traffic collisions or accidents. And just be aware of pedestrians and cyclists who are out there taking their exercise. And the final thing I would say is, obviously everyone's doing a lot online, and just be aware of online issues and to visit Stay Safe Online to make sure that the activity we undertake on the internet is safe. So that's my briefing.
Great, thank you, Rory. Paul.
Afternoon. We have more than 1,000 new claims now processed through the Hardship Fund. Calls to that helpline are now beginning to become more manageable, but we have by no means kept up with the submissions. We are aware many are waiting for their claims to be processed, and we continue to evaluate how we can safely put more resources to both the Hardship Fund and the support for business work streams. Each case can be very different and unique to individual circumstances. However, as we learn, we will endeavour to process applications as quickly as possible. Early indications from this first package of financial measures unsurprisingly show that some sectors of the economy are struggling more than others. The construction industry appearing to be the hardest hit, with more than 600 claims submitted to the Business Support Unit from this sector alone. Hospitality and the visitor economy are also suffering significantly, as are our transport providers, being the longest affected with travel restrictions imposed early on. Approximately 20% of all claims have now been processed, but this continues to be a significant task. I would particularly ask those of you that are chasing with follow-up calls just to have a little bit of patience, because all those calls have to be answered. For the finance sector, professionals and business, stricter measures imposed across the bailiwick have unsurprisingly had the least impact, with large proportions of their workforce able to work from home. In the public services, more than half our workforce are employed in frontline operational services that for the large part are made up of critical workers who continue to work in the normal way, albeit in extraordinary circumstances, whether that be our health and care workers, law enforcement or education staff. Of those in more office-based public service roles, we can broadly divide into 2/3. into thirds, with those working as normal and critical roles, for example, supporting the hardship fund, business support, communications, or processing payments and benefits. Many of these are working from home. We have encouraged as many as possible in non-critical roles to take their leave in the normal way in an attempt to minimise the strain on resources, specifically at a time where we will experience increased demand when we begin to think of delivering recovery plans. As the Easter holidays are now upon us, many will have had to sacrifice long-planned holidays, family celebrations and get-togethers, and we applaud you for being inventive and holding virtual quiz nights, dinner parties and get-togethers in the spirit of Guernsey Together. We appreciate your efforts to stay at home. However, of course, the conditions of the pandemic doesn't pause for the weekend or holidays, and our essential workers are working on. I must make a special mention to the school staff, both in Guernsey and Alderney. Of nearly 400 have volunteered to work over the school holidays to continue supporting children of our essential workers and vulnerable students. This remains a vital piece of the whole island response to this pandemic. We have been surprised and pleased about the amount of queries we have received from young people. We should not forget the sacrifices being made by our children and young people. For the youngest of them, it will be difficult to understand why they cannot go to school and see their friends in the normal way. And for the older year groups who have worked hard towards GCSEs, A-levels and IBs, they face the disappointment of not sitting their exams they've studied for and celebrate at a prom or with the trip with their friends or just hang out as we would expect young people to enjoy. So to all our younger viewers of this conference, we appreciate the sacrifices you're making for your community, especially in this lovely weather. Following the stay-at-home advice is helping to protect all our essential workers in the island. This time will be remembered in the history books for those that study after you. Thank you.
Thank you. Heidi.
I've just got a couple of brief points to make. They do cover quite sensitive areas, so firstly, we've had to make the really difficult decision to stop visits to the PH, Mignon Memorial Hospital, Oberland's Lighthouse wards and care homes. We previously said that regular visiting was stopped, but we've had to extend that over as a result of reviews over the weekend, and really been taking further ethical consideration this week based on emerging evidence. And it's been agreed to alter arrangements for visits for the continued protection of residents and their family and friends, staff and the wider public. So for care homes, there's no visits are allowed by family and friends for the foreseeable future, but that will be kept under constant review. We know that outbreaks we have seen in the homes have shown how vulnerable these settings are, and these measures are considered essential in the circumstances. For the hospice, again, no routine visiting, but end-of-life visits will be individually assessed. Where visits can be safely accommodated with appropriate safety measures, the staff may allow it under controlled circumstances. And for the hospital, visits will not be allowed on COVID-19 wards or with COVID-19 patients. In other words, routine visiting can't be allowed, but end-of-life visiting will be looked on a compassionate case-by-case basis. Such visits will only be allowed if it can be managed safely, and in general, even this visiting, I'm afraid, will be discouraged. On the other end of the spectrum, birthing partners will be able to attend a delivery unless they or the mother are symptomatic. And finally, just for clarity, people can visit someone in their home at their end of life so long as no one is symptomatic and social distancing guidelines are maintained. Now, secondly, on another difficult subject, I've spoken about domestic abuse at a previous press conference, but I'd like now to raise the issue of child abuse. The Islands Safeguarding Children Partnership, which is a body that brings together agencies that provide services for children and families, had a virtual meeting yesterday to discuss child safeguarding in the current climate. And they advised me that whilst robust efforts are being made to attempt business as usual, operationally it is a challenge. There are concerns that referrals into the multi-agency support hub that reviews child welfare issues have plummeted over the past 3 to 4 weeks to unprecedentedly low levels. With families having to live at very close quarters, tensions in vulnerable households will inevitably rise. So it was anticipated this would lead to more, not less, referrals. Vulnerable children are able to access school during the lockdown, which provides some level of safety, but many families have chosen not to make use of this. Now, although this situation's been mirrored in the UK, that's not reassuring for us, and we'd therefore like to ask any members of the public with concerns about a child and child safety to contact either the police in an emergency or the multi-agency support hub on 723 172, and further information can be found on the partnership's website at iscp.gg, and we'll add further details on the gov.gg's coronavirus pages.
Great. Thank you very much indeed. I've just got a couple of things to touch on before we open up for questions. The States of Deliberation had a trial virtual meeting this morning, which the consensus was that seemed to go quite well. So the plan will be to hold a virtual meeting at 2 p.m. next Tuesday. That's subject to the Civil Contingencies Authority meeting this afternoon to pass the requisite regulations that will enable that to happen. In relation to travel in and out of the island, something which Rory said just reminded me that there has been a media release which has gone out today on that subject in terms of looking at the further regulation or control of that, and on the advice of Public Health, the view is that is not required at this stage. The numbers are really very low, and a lot of that is travel between Alderney and Guernsey, and it is extremely well controlled. So there is felt to be no merit or need in imposing further regulation and any kind of permit system that would just effectively be creating bureaucracy for the sake of bureaucracy and add nothing really to the public health objectives. So that is a matter for public record today. I know Heidi is the same, have received literally hundreds of emails, direct messages through social media and so on, and both Heidi and I are attempting to deal with those on a one-to-one basis. If for any reason somebody doesn't get a response, please don't take it personally. It has simply just been lost in the melee of correspondence. And also, if it's directed to both of us, you will probably only get a response from one on the basis that it will be that we won't be seeking to trample on each other's toes. One of the pieces of correspondence that I've received very much is this concern, which Rory touched on, about the level of activity that's going on outside as people see it. They see people on the beaches and question whether that's compliant with the directions. And in fact, I was sent a photo yesterday of somebody who had, an essential worker who was travelling home, who sent me a picture of Cobo. And what he saw in the photo were lots of people on the beach. What I saw in the photo were lots of people, lots of groups who were incredibly well social distanced. And when I engaged in that correspondence with him by email, he accepted that indeed was the case. And I think what it really speaks to is this question of interpretation, this idea that people can go out and take 2 hours exercise. My idea of 2 hours exercise may be very different from Heidi's. Heidi may hop on a bike and go around the island for 2 hours. I might choose to go for a run, and somebody else might choose to go out of their front door, take a stroll, and sit on a wall for a bit before they go home. And I think we have to recognise that exercise is in the eye of the beholder, as it were, but also this is about the need for people who are cooped up for the other 22 hours a day at home to get out and get some fresh air and have some mental health and well-being. So I think we all need to learn not to be too judgmental about what other people choose to do. And I think in that context, fishing has caused quite a lot of concern of people standing on a rock fishing. And again, I apologise because I've certainly, in some of my correspondence and interactions, given some mixed messages about that. That has now been clarified in some media work yesterday. But I think it really all comes back to, we all need to think, what is the objective here? The objective is about maintaining social distance and about minimising journeys, and it is constantly that stay-at-home message. That is what we should all be doing as our prime objective. Is if we are not an essential worker, if we don't need to be out, we need to be at home. and to be using common sense in our judgments. And I think the fact that something is allowed doesn't mean that we actually all have to rush out and go and do it, whether it's armouring or something else. If somebody chooses to do that as part of their 2 hours exercise and they maintain their social distance, then they are complying. So I do completely accept that it is a matter of subjective judgment, that everybody will have a different view. But let's just keep in mind, what is the objective? It's about staying at home. If we're out, we maintain social distance and we minimise our journeys. And then finally, again, a repetition of something that we've said before, is government does not and cannot possibly have all the answers to all the questions in every scenario. So, and certainly Heidi and I will say this in the correspondence and the contact we have with people directly who present us with their circumstances and in essence say, what's the right answer? And often the right answer is, we can't tell you what the right answer is. Here is the guidance. You have to use your judgment. You have to decide whether this particular activity is essential and is consistent with the overall objective of staying at home and maintaining social distance when you're out. So that's a little bit of a repetition of some of the things that we've had before, but I think it is important because particularly as we have changed some of the guidance around, for example, the deliveries of non-essential goods earlier in the week, inevitably, as I said on whatever day it was 2 days ago, there will be tensions, and it's going to be hard as we work our way out of this, as we exit this. There will be a sense of inconsistency, and we will attempt to communicate the rationale for what we're doing and why we're doing it. But some patience and some common sense and some tolerance around that is going to be absolutely essential from everyone. That's enough from me. We're going to hand it over to questions. So who would like to start, please? Yes.
Hi, Rosie Alsop from Island FM. I've got 2 questions actually that have been put to us by listeners regarding support for businesses. This one is about sole traders and how they get paid. So the way I understand it at the moment, if you run your own business, you can claim through the payroll co-funding scheme if you present a wage slip. If you're a sole trader, you don't have a wage slip to present. So the question is, how are they to be paid? Are they supposed to enrol through Returns Creator, or is it preferable for them to apply to the hardship fund or go for income support?
I think the payroll scheme does apply across the board for that type of nature. I think what we're finding, and is mentioning in my statement, is a lot of circumstances are really unique and different, and this is new to the teams that are dealing with it, and we're actually almost having to build up our guidelines and our own knowledge as we work for these. Certainly one of the ideas as we've created this learning process is to try and put more information available online for those specific and different cases, and then that's a perfect example where we can add that to our current list of guidelines.
Okay, thank you. The second question is from someone who runs a childcare business, and their question regards looking after children of essential workers, which is entailing longer hours at work. They wanted to know if there's going to be additional support for this sector above the grant that's available for businesses.
That's something I'd have to take away and look into a bit further, but we can come back with you with an answer on that later.
Thank you.
Just in relation to that question, there are some, I'll say anomalies, but again, it comes back to the point that I was making earlier, really, that we don't necessarily have the answers to every situation, and I think that's one example. I think sole traders generally, what was designed 3 weeks ago as we were started, before we'd even gone into formal lockdown, is something that again in one of my virtual meetings today we've flagged needs to be considered as this period extends in order that we ensure that sole traders are adequately supported through this period. So we have recognised that it is a challenge. Okay, next question, please. Yes.
Hi, Laura Clayton from Bailiwick Express, and this question is probably for Heidi and Dr. Brink. So we understand that end-of-life visits are being individually assessed at Les Bourgs Hospice for understandable reasons, and end-of-life visiting will be looked at on a compassionate case-by-case basis at the hospital. And I know you did touch on this, Heidi, and we're told no visits are allowed at care homes at all. But we're hearing from some of our readers that there are people in the island who are at the end of their life unrelated to coronavirus because of their age, and it's under constant review. Under what circumstances could that be reviewed to allow end-of-life visits for residents in the care homes because of their age, not coronavirus?
As I said in the briefing that I just gave, Laura, unfortunately we know that the care homes are so vulnerable. I mean, that's why we've had those clusters. We know that the slightest somebody might be asymptomatic, you don't know, they go in there and they completely impact the whole of the care home. Got to be so careful, and that's why we're doing it. So yes, it will be under constant review, but at the moment we really think it's the best thing, and it's just such a difficult. I really do feel for families. It's not something I ever want to be able to have to say. I mean, none of us do. It's so difficult, and it's not what people expect either. But what the care homes can do is possibly help with using telephones or iPads, so there can be at least some interaction possibly over those last few hours and minutes. So unfortunately that is where we are at the moment. But yes, constantly reviewed, of course, as the evidence, as we always say, if the evidence changes and we look like we can get out of all this, then we'll be doing that.
Anything to add to that, Nikki?
I think nothing other than what Deputy Salisbury said, is that it's a very, very vulnerable group of individuals, and we know that particularly in younger people who are healthier, you can get asymptomatic infections. So we're really concerned about the protection of that whole group of individuals, and it's a heartbreaking decision. I mean, there's nothing else we can say about that.
And I guess the other fact which is pertinent in terms of handling this issue, of course, is the inability to permit visiting in COVID-related cases in hospital. So again, the reality is that there will be people who will die in hospital with COVID who will not be able to be visited by their relatives, and that again is I think everybody recognises is almost inconceivable for any of us to contemplate. But that is the really hard reality, and it, unfortunately, it cannot be. We cannot avoid it.
I think just to add to that, people's concerns that somebody might be dying alone in that situation, they won't be. This is where the nurses and carers come into their own, and will give that support at the end of life. So if people are really concerned that somebody be in a bed by themselves alone, that won't happen, and I hope that's some little assurance I can give to people in this time.
Next question. Yes.
Helen Bowditch, Guernsey Press. A question, if I may, to Dr. Brink. You explained at the last press conference that you were comparing Guernsey's overall testing numbers to the UK, but on the UK on the world stage is not being lauded for its testing programme. So I wondered if places like South Korea, the Faroe Islands, Germany, I wonder if they would make better comparisons.
Yeah, and indeed that's what we're looking at very closely, particularly as we start modelling what's going on in the bailiwick. We're getting more information by the day, and we're looking at comparing ourselves to other jurisdictions, and I think that's really important. The Faroe Islands strategy has been interesting. They've sort of tested the whole population there. I think the problem is that if someone's negative one day, they could be positive the next, so you'd have to have some sort of repeat testing program. So that's been an interesting program there. But looking certainly at the German experience, we're looking very closely at that. We've looked at not only their direct viral testing, but the role of antibody testing as well. And we are looking at how we can work direct viral testing with antibody testing, and we're looking at protocols for that. So really interesting information starting to come out. There's more information on antibody testing starting to come out. I've always been a little concerned about the data we've had, but there's more robust data coming out. So we're looking at that very actively. But I'm interested in the Singapore experience, I'm interested in the South Korea experience, and I'm interested in the German experience. So those are three that we're really shining a spotlight on as we look forward to either refining or modifying our strategies and interventions, and I think that's really important. Singapore and Germany, as well as South Korea, have had a very active test, identify cases, quarantine and contact trace. They've had some very robust measures, and I think at a population base that really is encouraging and gives some encouraging information.
Great, thank you. If we go to Rob to ask some of the questions which came through directly to us, Rob.
Yes, that's right. Rob Moore from the States Comms team. We've been collating the My Coronavirus questions that we invited last week, and we've dealt with some of the big topics in previous press briefings, but another one of the biggest topics that we've had questions on is exercise, which Deputy St. Pierre, you touched upon a bit already, but we've had questions on ormering, coastal foraging, fishing, and questions like, is it okay to drive somewhere to go for a walk, a swim or a run? And is it okay to exercise with one other person from another household, especially if both live alone and they don't have symptoms?
Okay, who'd like to take that? Heidi?
Do that.
Yeah.
So, taking the first question, is it okay to drive somewhere to walk, swim and run? Yeah, I mean, I think for a lot of people, they might have to drive to be able to swim, to go somewhere to swim anyway. So, and that's a necessity from that point of view. But we're not wanting people to just drive around the island and go home. If it's a necessary journey to do their exercise, that's fine, but just don't keep doing it. Can you exercise with another person outside your household? Yes, if it's just one other person, they're asymptomatic, and you keep your social distance. So if you're cycling along, I saw yesterday when I was on my bike by myself, 2 people cycling just right next to each other and having a good old chat. And I thought, well, that's A, it's not great on the road doing that anyway, but B, they should be socially distancing. So yes, you can do that, but just the 2 of you, and make sure there's that gap. So it's as Gavin said here, and when people have been asking all these questions, can we do this, can we do that? This isn't, I said the other day how it's not business as usual we're going to, but neither is it life as normal. So we don't want people just to go off and do what they want to do. It's about thinking ahead and just think, if you're in doubt about whether you can do something or not, just don't do it. You know, if in doubt, just don't go out. This is kind of my mantra on this. So can you go on ring when we said at the last conference, yes, you can, but think about it. If you've never done it before, don't, because it's quite a dangerous exercise if you haven't. Fishing, yes, you can fish on a rock, but then again, think about the danger about it and say, is it worth me putting myself at some risk? So in case, you know, the emergency services might have to come and pick me up. And that means that resources are diverted away from dealing with COVID-related issues. And I think people, you know, just use that common sense. You know, people just use their noggin to think about, well, why should I do it or not? What isn't allowed is recreational fishing out on a boat, and neither is scallop diving. We're hearing about scallop divers wanting to go out and have been diving. Well, that clearly isn't allowed. I understand from the UK, advice has come out to divers not to dive now anyway, but we've closed the hyperbaric chamber and we are not going to open it up for somebody who's decided, well, I don't care, I'm going to go diving anyway. We can't do that. And so people really need to think very carefully about what they do.
Okay, thank you. Next question. Yep. Sorry, you've gone in the middle. You haven't had one yet.
Sorry. Ewan Duncan, BBC Guernsey. Just a question for Dr. Brink. How concerned are you about the backlog of patients who might be seeking medical treatment at the hospital which have had to be delayed because of this?
Yeah. So I think there are 2 groups here. The first is the delay of elective surgery and elective procedures, and there will be a backlog without a doubt, and that's something that we are going to have to address in the months to come. So obviously we're concerned about that, but we don't think there's any other option at this point of time. I think I'd like to also focus on another group, and those are people who genuinely have an acute issue that needs to be dealt with. What I'd really encourage people is if they have something they're concerned about, don't delay speaking to a doctor about it. Now, sometimes you can do that through a remote consultation. So a lot of our specialists are setting up remote consultations where they can have an initial discussion and decide on the basis of the discussion how urgent it is to have an intervention. My concern during this period of time is that people who have acute medical problems that do need to be dealt with now and not in 2-3 months' time, that they get the relevant medical help and care. What I don't want to see is people delaying seeing a doctor and then presenting possibly too late for an intervention to occur. I think that's really important. So I think whilst we are really focused on COVID-19, is we're very, very cognizant that there are a lot of other medical issues that aren't going to go away that we need to deal with acutely. Some of them can wait, but some of them need to be dealt with acutely. So if any islanders have issues that they are concerned about, I'd strongly encourage them to discuss it with their doctor in the first instance to get an idea of how urgent it is. And that's probably one of my main concerns at the moment, is people just don't get help for issues that really do need to be addressed now.
Just a slight follow-on from that. We know that Dr. Raby said the other day the hospital is quite quiet. Do you think this is slightly a calm before a potential storm, or do you think that you could maybe start resuming cancer treatments or radiology perhaps?
So with regard to cancer treatments, as each treatment is getting a risk assessment on it, and they're taking advice from the national cancer bodies as well, and it's a question of whether the treatment needs to occur now or whether it can be delayed, or whether in fact now is a good time for it to occur. So what we don't want to do is have a one-size-fits-all, because every single patient is different, and what we're trying to do is make a program that's bespoke for them. So I think from our perspective, it must be focused on the need of that individual rather than us trying to fit them into a particular state that our hospital's in. So we need to focus on what they need now and then how we can deliver it.
Okay, we'll go to Laura, then Rob again, and then Helen.
Okay, a question for Paul. Unemployment figures. Do you have any up-to-date unemployment statistics, and do you have any idea yet what long-term impact this could have on Guernsey's unemployment, which was previously relatively low?
Yeah, I don't have the figures at hand, but we are starting to think, and I think we'll be talking more and more about this in the coming weeks, about how do we align our strategic thinking in terms of public health with our overall recovery, and how we regenerate people back into the working economy, and how can we do that? And it's going to take an awful lot of thinking through. I think Gavin mentioned earlier on, we will have to apply thinking and logic about who should go first, how do you make those decisions. But we are looking, I said construction industry is a good example where you can see being hit very early on, and how we could, following the public health guidelines, how could we introduce a modicum of return to work in a safe way and still manage that curve, as Dr. Brink says. So it is being good thought of, and we are looking very much at the statistics of who's making claims, what sectors they come from, and the impact on the economy, and how we reverse cycle that into our thinking around our recovery plans to pick up early on those that obviously most painfully hit.
Thank you.
Okay, Rob.
So another of the big topic areas in the My Coronavirus questions was about medical equipment, particularly PPE and ventilators. So I'll just ask a few of the questions we had in on those. Do we need, and are we asking for, more ventilators, and is it possible to get them? Are we ensuring that all health and care workers have the PPE that they need, including care home staff, community nurses, carers, and even outside of that, in the prisons, something we've commented on before? And should we be doing some kind of public appeal or appeal to businesses that might have PPE that might be useful?
Yep, I'm happy to do with that. I think that Dr. Raby, when he was here on Tuesday, said how we were much better off than the UK. I would use a UK equivalent in terms of ventilators per head of population, but we are looking at getting more. We've placed orders for 10 ventilators. 4 called Hamilton ventilators are due to arrive this weekend, and we've got 6 Draeger ventilators coming through in the future, which will help us for our future expanded ICU. We've had community financial support for that as well, which is great. We are, the procurement team, tracking down other related equipment, say like oxygen concentrators and other pumps and things like that. So that's ongoing at the moment. In terms of PPE, that is, we've got a central PPE cell. I mean, we talk about cells a lot, and I think, you know, we've probably got more cells in the prison, by the way. It sounds like it the way we're talking about it. But we have a PPE cell which controls PPE across the island for everybody. So that'd be care homes and community, police and everyone. In fact, I was sent some pictures just the other day about it, and I might put them on Twitter, show people all the packs that are made up in the hospital, which is quite interesting. So yes, and we have had a lot of support from that, and more support is welcome. I think we had donations of cloth masks as well, which is great. So what the community can do to support us more on that is very much welcome.
Great. Okay. Helen.
I think this question is for Mr. Whitfield, and I know you touched on this in your speech, but with many businesses having to furlough staff and lay staff off, and I know you said that a lot of public servants have been redeployed, and I think you said that some were being encouraged to take leave. Do you think, unfortunately, you might have to consider redundancies at the States?
I think the issue here is one of cost and affordability, something we will be talking more about in the coming weeks, is the profile of the cost of the whole COVID impact to our community and to our economy and to states funding. Clearly, I think the right question, because of course, if you talked about mass redundancies, you'd be talking about considerable cost and the impact that would draw down that, for example, on benefits, and it's a knock-on effect. I think the more pressing question is, in looking forward, is are we going to look the same? Do we need to look to the same, and do we have to change to be able to recover quicker? And that includes in terms of our cost base. And we might have to make some very difficult questions about what services do we maintain, what possibly do we decommission in a short term or in a longer term reach. I think that is the question for us, is what the organisation and the services we provide look like. Actually, we're learning by the day to do things exceptionally differently. I think business out there, the private sector, friends I've talked to have said, actually, we're running a lot of our business in a very different way. We're working remotely. We don't need as much office space. That's no different to the public sector. And I think we need to do that in a calm, considered and controlled way, because ultimately, by definition of public services, most of the things we provide are essential services in one way or another. So we must do that in a controlled way. But if needs be, we might have to reduce the size of the organisation.
Okay. Any other questions? Yes, you.
I know that, sorry, Deputy St Pierre, I know that you previously talked about an exit strategy. Are you able to give us any more detail on that and sort of how progress is going with it?
No, from having referenced it 2 days ago, other than it is something that is being actively progressed and involving a whole range of parties, including, of course, public health. Consider a range of people also thinking about the economic input as well, and we also need to think about the legal environment. How can we actually construct a regime that allows us to move to, if we're going to, if as is very likely, as I indicated a couple of days ago, we adopt a staged approach, which would seem to be the logical way to manage an exit. Then how are we going to achieve that legally? So there's a lot of work to be done. It is going on, and we will announce what the next steps are just as soon as some decisions have been made. Sorry, there was a question over here.
Hi, I've got a couple, but I'm conscious of time.
That's all right.
One for Dr. Brink regarding contact tracing. Is the contact tracing team still going back 2 weeks with people who test positive? We've heard anecdotally that it's been much reduced to as little as 24 hours in some cases.
So it depends when the person became symptomatic. So we contact trace to 24 hours before the person became symptomatic. So if you got symptoms on Tuesday, we'll contact trace for everyone on Monday. So sometimes when people aren't symptomatic, we'll then try and look at an arbitrary contact tracing time. So we've had a few people that we've picked up through contact or through our various testing procedures that have no symptoms at all. But by and large, it's 24 hours before the person became symptomatic. Now, that's the buffer that we always put in from the beginning, because you remember in the early days, there was a big debate about whether subclinical or asymptomatic or pre-symptomatic people could in fact transmit. We were always concerned about the possibility of pre-symptomatic or asymptomatic transmission. So that's why we chose not to follow the Public Health England policy of going from the day of symptoms, and we went back 24 hours before. So in that sense, the contact tracing is exactly the same. And if anything, it's we're doing more contact tracing now. What's really, really encouraging is that when we started the contact tracing process, we were getting about 20 contacts per person. And as we've gone into our test quarantine contact trace, we're now down to about 5 contacts per person. So you can see the efficacy of the whole contact tracing process kicking in. And that's how we're pushing down the curve. And I think that's really, really important.
Okay. Helen, and then Rob.
This one is for Chief Officer Mr. Hardy, if I may. I think you alluded to this in your speech, and a statement went out last night that sunbathing on beaches would not be allowed. Do you think, is this a little bit heavy-handed, especially considering for people that live in flats or bedsits? I think we can all acknowledge that if you've got a nice garden, then the lockdown is a lot easier. And it does seem like the public are complying with the lockdown. And I wonder if saying something like sunbathing is not allowed, I wonder if that could risk the public support for the lockdown.
It's a good question. The way that we are approaching this is it's about discretion, and it's about getting everybody to understand what this is actually about. And I don't think sunbathing is the issue. The issue is being out in public where you may potentially come into contact with other people and you may potentially either transfer or pick up the virus. And it's about having that social isolation that will prevent the spread of the disease. And I think if people are sitting on the beach in absolute isolation in the sun as part of their time out, there's probably very little we can do about that. But if people are starting to congregate and meet people and breach those guidelines, then that is a matter for us to engage and stop. We need people, as the Chief Minister says, we can't dictate to the population how they work within the rules and guidance, but we need people to understand that we don't want to put themselves, their families or others at risk by having social interaction. So we will use common sense, but we also ask the public to use common sense. So if someone sits on the beach for 10 minutes, gets a bit of sun, but they're on their own or they're with their family unit and they're not having contact with anybody else, that's one thing. But to probably spread the towels out, set the barbecue up and set that up on the beach, that's a very different issue, and I think that sends out the wrong message.
Okay, Rob and then Ewan.
So through the My Coronavirus questions, we had a whole range of questions about various public services and which ones are still happening and which aren't and which ones are kind of secure. And I'll just pick out a couple of those. Someone who says they've been watching the TV show Cobra wanted to know how resilient our electricity supply is and what kind of backups we have. And one other one, how are we, our driving license renewal still being handled, and how can people renew a license if it's about to expire?
Yes.
The first question in regard to utilities, and specifically electricity, all the utility companies are now operating with their business continuity plans. Certainly in conversations with GEL, the subsea cable provides a very secure and resilient link to sustainable power resources, but also actually given the springtime of the year, almost the entirety of our electricity supply is taken from that resource, not forgetting that we've also got backup generators, and in fact we can run the island's power supply at this time of the year without the use of all our emergency generations. So there's a lot of resilience built into that, but I would actually replicate that. That's across our utilities in terms of resilience. The second question, in terms of driver vehicle licensing, Of course, at all times, you need a valid driving licence to be fully insured, and it's the correct thing to do. We are treating those sort of applications as a priority. We've got a skeleton staff working down at Bull Avenue where the physical aspects of driving licences need to be operated. They can be contacted directly by gov.gg/driving licence or on the phone line 243 400 if you need to make an immediate inquiry.
Just a question for you, Rory. Are you able to discuss with us how your police officers are maintaining social distancing while still going about their duties? Can you sort of describe the process now?
Well, yes, one of the things I'd like to actually put out is that if people call for police assistance or call for an ambulance, as part of that call we would ask people to be very clear whether they've got symptoms or they have any signs that they may have the virus, because that gives us a clue as to how to deal with the response. Now, if we're dealing with a very low-level issue with no indication that there's anything connected to the virus, our officers will attend and maintain social distancing and hopefully deal with whatever we have to deal with. If we're attending in a situation where someone may be unwell or have symptoms, if they've told us about that in advance, we have access to protective equipment which we will use on a risk-based basis. So if it's very low level, we'll probably use a mask and some gloves. When we're dealing with slightly more obvious COVID-related areas, we have access to a higher level of protective equipment. So we base it on a case-by-case risk basis, but we'd ask the public to be very honest and upfront, particularly with JESIC if they're making a call into the Emergency Services Control Centre about those factors.
And I know you mentioned it earlier about a couple of people that you've had to, rest or whatever it is. Will more details be released on that? And in terms of Jersey, they've seen quite a high number and quite large fines as well. Is that something that Guernsey's going to look to replicate?
The legislation is there. If the evidence is there, and obviously any case that is prosecuted goes through an independent assessment prior to a prosecution being laid. But as I said, we have a couple of files that are now with the Crown officers to see whether there's sufficient evidence to pursue a case, and I can't comment further for sub judice reasons.
Good. Any other questions? Helen?
Could I ask Dr. Brink to give us an update on the situation regarding care homes, about how many positive cases there have been within the care homes and in staff?
Yeah. So we've got 2 care homes involved, and the one care home has had 18 positive staff members and 16 positive residents. That particular care home we're due to do further sampling on. So although we've tested everyone in that care home, both staff and residents, we plan to retest everyone over the next few days. It continues to remain challenging. Health and Social Care has put in both nurses and healthcare assistants to assist in the one care home. They are accessing PPE through the PPE cell. The second care home has 13 residents and 13 staff that are COVID-19 positive, and again, appropriate access to PPE or access to the PPE cell has been given to those care homes for them to discuss any of their needs. So that's in relation to the 2. I think it just shows how vulnerable this group of individuals is, and it's really, really important as we move forward to try and see how we can protect these groups of individuals. And that was one of the reasons why the extremely difficult decision with regard to visiting was made.
I think it's also worth adding in relation to the care homes that, of course, the call was put out for anybody to step forward if they were able to assist. Yeah. That process is going to lead to interviews and induction over the next few days. So that's we're obviously very grateful for those that have stepped up.
The care homes have also got a GP allocated to them, and they've got a consultant geriatrician who's overseeing any needs that they have. So we've tried to put in that additional help that is required in these really unprecedented circumstances.
Okay.
Back to Chief Officer Hardy for a question on domestic violence, and I know Deputy Soulsby touched on this and the drop-off in numbers regarding child safeguarding and what we can take from that. But have Guernsey Police seen any increase in phone calls regarding domestic abuse? Because presumably there are heightened tensions in some homes. There have been some very tragic stories in the UK during the lockdown as a result of domestic abuse. Has there been any increase in calls locally?
Looking at the figures locally, they're fairly consistent on what they would be ordinarily. So we haven't seen an increase or a spike, but I certainly echo what Deputy Salisbury said about the child protection element. Some of our most vulnerable have regular contact, for example, through schools, and that clearly those avenues aren't there for issues to be picked up. And I would just replicate what's been said, that if people have concerns, please don't wait, raise those concerns with us, and obviously we'll deal with these things in a very sympathetic way, but if there needs to be an intrusive assessment to make sure everything is okay, please don't hold back on making that call, and we will do that.
Okay, Rob?
I have a question on behalf of ITV Channel, who submitted it in advance. They're following the briefing remotely for Dr. Brink. They wanted to know if there's any additional information you're able to give on the fifth confirmed death or the two kind of presumed COVID deaths.
So the deaths that we've seen are within the care home sector and are all people in their late 80s and 90s that have very sadly occurred. We're not going to comment on specific cases, but from the latter part of their 80s into their 90s, so very, very sad and a very vulnerable population.
Okay, time for one more. Ewan.
I was just going to ask you, Paul. Obviously, we know the recycling bring back centres have been closed now, and jokingly, a lot of people on social media have been saying they're quite embarrassed about the amount of glass they've got to be picked up, presumably a lot of wine being drunk on the island. In terms of your staff, do you think that you'll be able to cope with the presumable surge in demand?
Yeah, I think it really, in terms of handling what is picked up on a daily rate now, yes, we've got enough resourcing in there and the way we're rotating teams to be able to cope with that at the moment. Of course, we're asked routinely questions such as the green waste sites. Are they going to open up because of piling up of people that are doing more gardening? But I think this is all part of our next phase to say, if we can consider our sort of exit and our return to work in some areas as part of the recovery, where could that be and where could it be done safely? And certainly the green waste site is one where we're considering how that might operate in the future. Just finally, just a little bit of an update that I've managed to get while we've been talking. Someone asked about the unemployment figures. Actually, 120 further applicants have gone through to payment on unemployment, and 100 are waiting in process. But I would say always to encourage employees and employers to work with the payroll scheme as much as they possibly can, rather than driving through to unemployment, if at all that is possible. Good.
All right. Well, thank you very much. We do not plan to have another media briefing before next week. So we hope everybody has a good and enjoyable Easter weekend. And the time and of the next briefing will, of course, be confirmed with everyone here, and indeed, of course, through normal channels to the public. So thank you very much, and have a good weekend. Thank you.